Thanks, Saul. So I'm going to sit because of a sixth grade experience. I gave a presentation to my best friend, peer evaluated me. We were asked to peer evaluate, and she said, Meg's presentation was great, but she was talking too fast and she was swaying wildly. Those were the words. So it made me very suspicious of standing up and even more suspicious of peer evaluation. But hopefully you'll be a kinder crowd. So I'm going to talk to you today about Maternova, which is a concept and a company. And it starts off kind of grim, but then it gets better, into better news. So the issue I'm obsessed with is how women die in much of the world. I don't know why I'm obsessed with that issue, but I am. And if you don't have HIV, or you're not going to get HIV, the most prevalent way that women die in Africa, Asia, and parts of Latin America is in childbirth. And you know, with all we hear about global health, this issue is sometimes left aside. So that's in many countries. That's about 1 in 16 women, 1 in 30 women. If you think about the rows here, there's about 9 or 10 people in a row. In the hardest hit areas, it's 1 in 8 women will die in their lifetime from childbirth. And there's nothing more profound than I can say than these women are dying while giving birth. It's shocking to me. And there's some good news. There's a lot of progress being made. This is my focus and my company. I approach this from a lot of different perspectives. One of them was I thought it would be a good idea to live in Borneo in a maternity hospital for 6 months. And we heard from Richard, I think, this morning about place. That was not a good place for me to be. That was not fueling me and inspiring me. And in fact, you know, I ended up sort of developing a heart condition. So that wasn't going to work. Tried a lot of other different things. And where I ended up was this idea of Maternova, which is a global marketplace for tools and ideas that save women's lives. And it's building on a wave of what hundreds of other extraordinary people are doing. It's a story that's unfolding, so I thank Saul and Melissa for having me here at the beginning of a story rather than the end of a story. And I'll be able to tell you some concrete things about our virtual marketplace, our website, and the actual physical kits that we're sending out and prototyping. So I want to start by setting the scene with a couple of slides that were published in photos that were published in Time magazine in May, part of a global movement to put maternal health on the stage. They're a little bit disturbing, so if you're pregnant or don't like blood, you should just probably close your eyes. But they're not unbearable. So this is a story of Mama Seske. This is an 18-year-old girl, really, who was forced to marry at 14. Her story is the story of 1,000 or more women a day. She traveled in a canoe after delivering her first twin, her village, to this clinic, okay? She arrives at the clinic. They're trying to save her life. There's 4, 5, 6, 7 nurses and midwives that you'll see, and I want you to watch the nurses and midwives and how hard they're trying. She's screaming, I'm dying, I'm dying. This is the record. I wasn't there, thank God. Mama Seske starts to bleed. You see the blood all over the floor. They rush her across the hall to see the OBGYN who could actually maybe help her if he had or she had the skills. On her way out, she's not doing well at all. This is after 24, 30 hours in labor and delivering the first baby. And this is the end of the story, really, and the beginning of a new one. This is the nurse telling her mother that her 18-year-old girl just died in childbirth. And these are the stories that keep me up at night. Like I said, 1,000 times a day. This happens often from bleeding, sometimes from a hypertensive disease called eclampsia, from infection, and from botched abortion. So that's the hard part. We're done with that. That's what motivates, what I do and really what my heroes and heroines do, and those are the midwives and nurses that you saw working there. There are 350,000 midwives and nurses like this around the world. Nurses and midwives are, in many countries, the biggest part of the workforce, and they're largely female. So anyone interested in economic development, business, and women, these are people really to look at. And to me, I see them as a hope, and I see them as a market, really. And so the way that Maternova started, like I said, it was a long story that involved this little stint in Borneo. But I started to see really exciting things happen, several waves happening at once. One was the wave of social entrepreneurship. There were amazing designers and engineers and med students getting together out of universities and creating really cool tools. You probably heard of some of them, and neat ideas and new franchises and business models for healthcare in low-income settings. There were amazing tools. Maternal health was now on the global stage, and I was following this, and it was my passion, but I still couldn't track it all. And so I really needed like an Evernote. This was before Evernote was out, and I now love that program. But I needed an Evernote for my maternal health obsessions, and I couldn't find one. And so I just decided to make one, and that's how Maternova started, was a visual online index of everything that was happening in innovation, and I know I should probably say everything that's happening in cool tools and ideas, because we don't want to overuse the word innovation. Put it all online and share it. So that's what we started to do. We started to connect what else is going on, tell people about it. Unlike some foundations, which unfortunately have a huge influx of ideas, but they don't let us know what all those ideas were, all the ones that came in and they didn't fund. Then we started to package those simple tools and send them out and get feedback. And then we started to design a couple of our own really simple products and some software to map clinics really quickly. And I think that's sort of what is at the core of Maternova is, how do you design a business that is urgent? How do you urgently design business? How do you have an urgent business focused around design? And those are some of the issues that we play with by connecting, creating, and designing. I thought, what if I made, instead of a nonprofit, a small, nimble, creative company that focused on packaging efficiency? And some of the pushback I've gotten on that has been interesting. My favorite comment was, well, so how are you different from Blackwater? So it's been an interesting journey. And to test is this interesting to anyone else? Is my Evernote online interesting? It is. 10,000 people, unique users from 150 countries have come to the site. And there are amazing stories that come out of those connections and the comments that we get. So let me tell you, this is what the site looks like. Mapping health innovations, or the Evernote piece, and the obstetric kits. We collect tools. We are as interested in the tools coming out of NASA and DARPA as we are the tools coming out of Maker Faire Africa. They're all equally important in how to save the lives of a woman like Mama Seske. This is a simple Pinard horn. It's a horn that's traditionally been used to hear a baby if you don't have a stethoscope, and it's surprisingly effective. So that's a simple tool that we look at. If you don't have an advanced anemia detector, the WHO, the World Health Organization, has developed this really simple color scale to test whether a woman is anemic or not. Remember Mama Seske and the blood on the floor? If you're anemic, you can die of postpartum hemorrhage more quickly. So that's really interesting to us. How do you detect anemia for a few dollars? How do you hear a baby if you don't have a stethoscope? What are the drugs that could have saved her life, and are they in this little pack that's a pre-filled syringe? We get really into some of these little tools. We're also just as interested in what Architecture for Humanity has to offer in the design of the space as we are in what nanotechnology has to offer. We love the idea of putting it all up there in one space and seeing what happens and seeing how those tools and ideas are used. We're not just interested in tools, we're interested in mini checklists and protocols too. We're interested in innovation in the most unusual places. This is my absolute favorite quirky thing. This is a solar-powered vaccine cooler that's been designed to fit on the back of a camel. And this is not by a nonprofit, this is a company that designed this. So there's a market where you least expect it. I love that example. We also try to think outside the bag or the traditional midwife kit. Again, if you look at the traditional global health lists of what's in a kit. It's drugs and midwifery tools. We are experimenting, and it is such an experiment, but we're putting simple tools in a kit. We're putting things like a headlamp in that kit because these midwives are delivering at night with no light. We're putting power in the kit. This is a windable mobile phone charger. You may or may not know that now more people have mobile phones than have toilets or access to toilets on this earth. So that clinic that you saw, rough as it was around the edges, those women probably have a mobile phone. So they need light. They need solar-powered headlamps. They need power. And yes, we look at transport too. There are companies all over Africa that are developing really neat transport mechanisms. This is a little sidecar that goes on an ambulance, again, to get a woman faster than Mama Seske was able to get to the clinic. When we send these kits out, and we sent them for feedback from 7 countries, we get immediate feedback. So people are emailing us, or they're sending a written form with whoever brought them the kit. We get immediate feedback, and it's really interesting. It's usually we love the lamps. It has nothing to do with the other stuff that's in the kit. That's really interesting information in and of itself. Then it's really interesting cultural things like we love the lamps, but we wear a headscarf, and we're not taking our headscarf off because we're Muslim, and you need to redesign that band that headlamp goes on so we can put it over our scarf. And we're sort of not waiting to find that out and perfecting this. This is made of Tyvek. It builds on the practice of suitcase stuffing, which is what all the doctors from Doctors Without Borders and others who go overseas, back and forth between this world and worlds like you saw in those slides. It builds on what they do, which is stuff their suitcases absolutely full of supplies. And we're just putting a core set of supplies for saving women's lives around the time of childbirth in a pack. And we also ask, what would happen if the key life-saving technology, life-saving protocols, the medical checklist that Atul Gawande talks about, what if it was in the bag? What if it was on the bag and the bag could hang and it could be on that wall? And with the stuff in it and the knowledge here, you could help save lives. It's not the answer, these women need better training, they need telemedicine, they need mobile phone updates, but all that stuff is already happening. I mean, that's the incredible thing. It's already happening, and we bring those things back and put them on our index. So this is my favorite, one of my favorite non-camel related innovations. This actually is a anti-shock garment. You buy time by wrapping this Velcro wetsuit on a woman. You reverse shock, and you can buy her time and save her life. It's being tested in clinical trials in multiple countries around the world. It was invented by NASA in the 70s. And our sort of mantra is, remember, urgent business design. What else is in NASA and DARPA and everywhere else that we can't wait from the 1970s to 2010 to be testing this stuff? It's too long to wait. And so we look in all those sorts of nooks and crannies to speed this up because this thing could really, really make a difference. And the price is going down. Other stuff. That's the kit. I'll talk about that in a minute. Blood bags. If you measure the blood up front, you know how risky it's going to be. This is our take. You can't see it that well, but it's a silicone cup based on the squishy silicone cup stuff. And one of our questions is, why can't it be beautiful? I mean, you saw that scene. It's dire. It's urgent. Why can't it be beautiful? Why can't there be a beautiful reminder on the wall for these women? Why can't the cup be cute and sort of modern? We want to bring that aesthetic. Emerging ideas. Artificial blood. If you had artificial blood and you had it in the clinics, you would save lives. This stuff is happening. Rice students, you may have seen this in the paper this summer, Rice students created a salad spinner centrifuge to detect anemia. It's $30 now, it's gonna go down. Amazing stuff, and it's done by students. And we wanna track what's coming at the same time that we wanna send out what's actually happening. We want to target those women, those nurses, and we want to brand this so that it's thank you for all you do for women, because, I mean, you saw how hard they were working, and we sort of feel like nobody's thanking them. And finally, I just want to end with this quote. This is by Helene Gayle. "We have to stop being polite about this issue. Postpartum hemorrhage is a nice way of saying we let women bleed to death." And I think, you know, in keeping with the beginning of BIF, what we heard yesterday, BIF-6, make the ununderstandable understandable. Don't call it postpartum hemorrhage, call it what it is. Thanks.